Welcome to 12 to Your Health. I'm Dr. Derek De Silva. Today we're talking about receding gums. What causes the issue, how is it treated, and can it be prevented? Well, for the answers, we turn to Dr. Vladimir Gashinsky. He's behind the Holistic Dental Center in Millburn. Doctor, welcome to the program.
Thank you for
So,
me here.
receding gums, can you just tell us a little bit about what it is?
This is a gums pull from the tooth. They cover the roots and don't pull out, and they look much longer.
And what causes this? Why does this happen?
It's a lot of causes. Main causes is bad brushing, grinding the teeth at night, and sometimes wearing the braces.
Okay. Now, we're looking at some pictures here. Can you please describe what we see, tell us what we're looking at?
We're looking at receding gums on the upper jaw.
Mm-hmm. And the gum, as you can see, that yellow
It's pulled up, and this is not the gum yellow, this is tooth structure. Shows more yellow because the hard tooth structure. Mm-hmm. It's just more white, and the gum receded, the root structure, it's more yellow.
So, what's the bad thing about this happening? Is it painful? Is it, what's the downside of this?
Downside of this, the roots become sensitive, teeth become sensitive. Teeth might decay. You may even lose the teeth because it's a blood supply, and the supply for the bone, it just disappear. Bone is disappear as soon as the gums disappear. You may lose the teeth.
And what about treatment? What are the traditional treatments that we have?
Traditional treatment is traditional gum surgery. In traditional gum surgery, they take in the piece of the gum from the roof of the patient's mouth, and they just moving it to the receding area.
Okay.
And they just move the gum from the receding area away and put in the piece on the top of receding area and suture.
That
It's
looks way too painful.
Yes, it's true. You know that sometimes next 2 weeks it's very difficult for the patient to recover.
Yeah, let alone recover, let alone eating. And then this is, we're going to have, in our next segment, we're going to talk a little bit about what other options and what things else, what else we can do. But what is the best thing to do to prevent receding gums? Is it brushing? Is it better brushing, flossing? What is it?
Proper brushing technique. Make sure that if you're grinding and clenching your teeth at night, you have a protective guard. And make sure you don't have a gum disease. Make sure that everything just taken care of before it happens.
Okay, very good. Well, we'll get into more detail when we do our next segment, so thank you very much for joining us today. It's a pleasure to have you with us. And folks, and here's what we're working on for next week. And remember, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m.